How bad was the pain before the surgery?
There was so much I couldn't do because the pain was shooting down my leg.
How bad was the pain?
At least a 10 or more.
10 or more. How long did you have that pain?
Probably 2 years.
2 years. How long could you walk? What could you do in your daily activity?
I couldn't walk very far. I couldn't do it.
Yeah. Almost a year ago, I think, we did the surgery.
Yes.
And actually, it's 11 months, not quite a year, but this
November
is the
18th, I think.
This is the surgery we did. We did a 2-level OLIF, minimal invasive fusion. These are the screws. They are in perfect positions and bone actually growing very nicely. And here, the bone is growing in the back. Here, the bone is growing in the front, and the back of the bone growing here. We see that the bone is going across, and everything looks perfect. How long did you stay in the hospital after that surgery?
1 day.
Just one night.
1 night.
May I ask you how old you are?
I'm 75.
75, 70 good 5 years. This, after open surgery, would have been impossible. Just stay one night in the hospital and go home next day. And I remember we did that surgery under 1 hour. It wasn't even 1 hour for us to do that surgery. And we lost barely half a cup of coffee blood. That's all we lost.
Really?
Yeah, so it was a good surgery. Now, how do you feel? How are you? How's the pain that you had was 10? You
The
said
pain is gone, and I'm just waiting for the rest of the healing to finish.
Yeah. How is that pain?
There is no pain.
There's no pain.
There's no shooting pain.
Yeah, when did you stop having that shooting pain?
Well, if I'd had any after the surgery, I would have known it. So
Yeah.
I don't think since the surgery.
Yeah. Are you able to be independent and take care of yourself with daily
Oh, yes.
activity? Okay.
Yeah.
How long after the surgery could you take care of yourself and be independent?
That took a while because I was on medication
Mm-hmm.
and limited to what I could do.
Yeah. Now, I have a question for you. Was the pain that you had before the surgery, was it livable? Could you live with that pain?
Oh, that's tough.
Yeah.
I'm gonna say no because it was so bad that when I got out of bed, I had to stand there.
Yeah.
I mean,
So it wasn't livable.
no,
Would you want to live with it?
no,
No.
absolutely not.
I have a question for you. What about if your insurance says, we don't pay for it, you have to live with it? What would you say if somebody, thanks God you are in Medicare, and Medicare never make it hard for us, but some insurance do. If imagine you had an insurance that would say, no, you have to live with it. What would you tell that person who would say you have to live with that pain?
I don't think I could repeat my words.
Okay. I know.
That's a horrible thing to tell somebody.
That's a horrible thing to say to somebody, to have to live with it.
Right.
Or you have to, and unfortunately, because of your age and because of your situation, the alternative to surgery we did would be open old-fashioned surgery. And open old-fashioned surgery, because the risks are so much higher, is often not provided to people in your age group. Whereas we can do as 1 hour surgery, open surgery is 4 or 5 hours, and that's your body just behave differently. So that's not offered to many patients.
Well, and another thing that was a benefit for me, it was because of this surgery, I found out I had a little something, and they
When we
put
did the clearance,
3 stents in.
Yeah. So for the surgical thing, we cleared you for the surgery, and we found out other things that could have
Right.
caused significant damage to you.
Oh, I had no idea.
Well, here you are.
Yeah.
This has been a journey, and you're still going to get better. But overall, I'm very happy. Bone is growing. Your pain, the sharp pain, is gone. The rest of it is going to get better. Obviously, I didn't make you 35, but but I'm happy with what we have achieved.
I'm
so far.
happy being 75, and I just know it's gonna get better and better.